All right, everybody, good afternoon. My name is Vivek. I am an otolaryngologist, head and neck cancer surgeon, but ENT is fine. But I do specialize specifically in head and neck cancer surgery. And I'm part of WellStar Medical Group and WellStar Health System, which is one of the major health systems here in the Atlanta area. So when I think about well-being, I look about it as something on a continuum, right? We have this aspect of our social, mental, physical, and emotional well-being on one side, and then things like burnout and depression and suicide on the other, okay? And we all kind of fit somewhere in this realm. So as I go through this talk and some of the different topics that come up, I want us to all think about three different things. The first thing I want us to keep in mind is what is the status of well-being in my office? When I think about the physicians in my office, where does everyone sit? Second thing is when I think about performance, how does the well-being of my physicians affect performance? And the last thing, what is the culture of my organization? What does the culture of my organization value? I want you to keep that in the back of your mind as we go through this talk. So let's get to it. WellStar, for those of you who don't know, it's 11 hospitals. We're a nonprofit institution. We have 20,000 employees, 1,400 physicians, comprising 240 different practices. So in addition to my clinical work, one of the things I'm doing is spearheading basically an entire system cultural shift toward that of well-being, of wellness and compassion to one another that affects not only the individuals and physicians, but also the patients. So are we going to take care of our communities at the same time as we're taking care of ourselves? So I'm hoping that some of the things that we're working on at our system level might be applicable to you. So we'll start with something that's all over social media and popular culture, and this idea of burnout, right? Physician burnout is everywhere. It's in op-ed columns in the New York Times. It's on jokes that you read in the New Yorker. It's everywhere. So this whole idea of burnout, classic definition by Maslow, was emotional exhaustion, depersonalization, and a lack of fulfillment, and a loss of fulfillment. It's noted that 50% of doctors, nurses, and administrators have some element of burnout. 30% of primary care doctors between the ages of 35 and 49 are looking to leave the field altogether. Not listed here, in 2017, Sinsky from the Mayo Clinic came up with another study, and they found out that 1 in 5 physicians are looking to decrease the amount of clinical time they're going to spend in the next year. 1 in 50 are looking to quit medicine altogether in the next 2 years. So if you do the numbers, that's quite an issue when we're thinking about having access to health care for our communities. There was a study about, in general, through the US population, about work-life dissatisfaction. Physicians were having higher increases in work-life dissatisfaction compared to the rest of the population. There are higher suicide rates. If you look at individual practices, critical care medicine docs tend to do the worst, according to this survey. Age distribution, you can see those 45 to 54 have a little bit higher levels of burnout, although previous literature would suggest that new graduates out of their residency tended to have higher levels of burnout as well. And 400 physicians a year commit suicide. So let's look at some specific characteristics. Depersonalization, we're talking about negativity, insensitivity and callousness to our colleagues, cynicism, compassion fatigue, sarcasm, being detached from those around us at the job. Emotional exhaustion is that feeling of being overwhelmed. You can't take anymore. If you guys put one more patient on my schedule, who's double booking me? Why is this happening? And then low personal accomplishment. I don't really feel like what I'm doing matters anymore. I don't believe I'm accomplishing anything. This is not what I was planning to do. So Maslow, in her seminal papers that she wrote, talked about this being a deterioration of one's values, dignity, spirit, and will. So you hear a lot about burnout and all its implications, but it's kind of become a catch-all phrase, and it can include so many different things, whether it be leading to depression or this idea of moral scarring and moral dilemmas, and we'll talk a little bit more about that. But it does encompass a lot many things. It takes us to the same place. So what are some of these external forces that we're talking about? Well, increased productivity demands, decreased reimbursement rates, increased expectations from the public with same-day appointments and now telemedicine and e-chart messaging. The electronic health record obviously is the big elephant in the room, right? 50% of physicians' times are spent in front of that thing. 37% of time within appointments when you're supposed to be face-to-face with your patient, it's actually spent on that computer. So there is a bit of disconnectedness that physicians can feel just going through their day. Reduced autonomy, government regulation, medical legal issues, this all kind of adds up. But kind of near the end, we talk about things like conflicts of interest. In this world in which we are judged online for the way that we interact with patients, patient satisfaction scores can be a huge source of distress for a physician. But it's also a little bit of a conflict of interest because as a physician, we're put in a position where we want to do what's best for the patient, what we think is right for the patient. And that may not always be a popular view. And so are we going to sacrifice doing what's right for our patients knowing that we could suffer the consequences online for it and therefore hurt our own practice just by doing what's right? What about this? Can I maintain a certain level of excellence in the way I practice medicine in a volume-based medical system? Is that even feasible? So there's lots of reasons to feel distressed in the medical field, no question. And that's one of the main points that Dr. Shannonfeld, he used to be at Mayo, he's now heading up the WellMD program at Stanford, and his point is this: burnout's a systemic issue. This is not a limitation of the individual. This is not the doctor's problem, and if we just intervene for the doctor, everything's going to be okay. It takes a more holistic approach to try to improve something of this import for the long term. So some of the repercussions, we've kind of touched on some things: broken relationships, substance abuse, depression, suicide. Professionally, the literature has shown there is decreased quality of care, increased risk of medical errors, decreased patient satisfaction scores, decreased productivity and effort, an increase in turnover, and this, again, loss of meaning at work. Financially, the impact can be huge. In a medical system like WellStar, if a physician leaves, turnover costs with recruitment costs, loss of revenue, onboarding costs, licensing and relocation, you can get into the millions per physician that leaves. Turnover rates are double those that have burnout compared to those that do not. So this idea of, is there a financial impact to my institution for not paying attention to this? Well, yeah, there is one. And then we talk about this whole idea of patient safety. As burnout increases in a physician, the rate of major medical errors also increases. And the flip side is true too. If we can increase physician satisfaction and well-being, we can increase quality of care, and we can increase patient satisfaction scores. So who can see this? From a system level, sometimes there's a big disconnect from the docs on the front line all the way up to the C-suite. So the idea is, can someone up there see a doctor struggling? Can someone see a doctor in distress? And I want you to think about your own practice. And can you think of doctors that may need some counseling or some advice or someone to kind of discuss things with? As a colleague, if you saw someone, would you intervene? Would you take the time to make an effort and try to help that person? Would you talk to the senior physician in the practice and say, hey, look, I'm really worried about this, doc. Can you help us out with this? What about the individual? Can we see it in ourselves? So a study did come out on this, and I love this study. There's a well-being index that was created by the Mayo Clinic, and it looks in kind of a survey of how well off are we doing? Where is our health really, and where is our wellness level? So they gave this survey to 1,150 surgeons across the United States. And they had them take the survey. And after they were done, they just asked them, hey, how'd you do? That was it. That was the study. The bottom 30%, the people that did the absolute worst, the surgeons that if you saw, you would think, man, we got to get this person some help. That group, 70% of those docs thought they were average or above. That's crazy. 70% thought they were doing just fine. So there's clearly a gap in our insight of where we sit with this. There's a blind spot there. And maybe part of our roles is to help one another illuminate those blind spots. So metrics that are out there for well-being, the Mayo Well-Being Index, it is proprietary now. The Maslach Burnout Inventory is classic. There are licensing fees associated with that. The AMA has come out with a program called Steps Forward. And if you guys haven't seen this, please take a look at it. It's on the AMA website, and they actually have access to one of the burnout metrics, the Mini-Z, and that's available to anyone. So I'm going to refer back to Steps Forward. There are a couple of slides that I have directly from there, and I'll point those out to you. It's the AMA Steps Forward. So some of these drivers of engagement and burnout. So if we think of that continuum again, there are different factors here that can be addressed that we can kind of help tip the scales in one direction or another. One is workload and job demands. Two is control of the schedule. Does a physician have the ability to control their own schedule and the flexibility to change it if necessary? And how does this affect their work-life balance, or life-work balance, as I like to say? Work, the social support community in the work. Is this a place where people feel welcome, where it's a safe space? It's a fair and just culture. And that brings up to what are the values of our organization? What do we value the most? Who gets promoted? Who gets rewarded? Who's looked upon as the champion of all things great in our practice? Because that tells a lot about the values we have ourselves. Efficiency and resources, are they available? Can we even do the things we want to do to be as efficient as we want because we have the resources to do it? And then obviously the big thing is meaning. Do I have a sense of fulfillment for what I do? So we can tip the scales toward engagement, or we can tip the scales toward burnout. I think there's three spheres of leadership when we think about changing a culture. Leadership in the system, leadership of the team, and leadership of the individual or the self, okay? And at Stanford, they came up with a framework that kind of addresses these three things. They talk about a systemic culture of wellness, which is these values and attitudes and behaviors that promote self-care, personal and professional growth, and compassion for colleagues, the patient, and the self. They talk about efficiency of practice, which is value-added clinical work divided by time and effort. And then finally, individual resiliency. This idea of, do I have a set of tools and skills that can promote my own personal, physical, emotional, psychological, and social well-being? So this is kind of the framework that I think about when I'm trying to figure out, well, what are some of the steps that I can take? What are the things that I can introduce to my system to try to improve things? And as an individual, these kind of blend together over a point: individual factors, local factors, and then obviously system factors. I'm only going to touch on some of these things. It's a general overview of those things at a high level. So first, individual interventions. What is my life-work balance, and am I developing my life outside of medicine? Dedicate a lot of time to our career, but I'm not putting even 10% of that effort to developing my life outside of my career. Limiting the effects of these external forces of burnout. Do I have an outlet? Am I able to not feel the distress that most people feel trying to work in this environment? Am I improving my individual resiliency? We actually have a resiliency program where we put people in retreats for 3 days, and we actually have them really work on themselves at a level that's away from the hospital, away from the city, even away from their families, and just focus on themselves. Am I focusing on things like mindfulness and staying focused and present so I can do the things I need to do and be there for my patients the way I want to be there? So as we move toward what can we do to promote this at work, is well-being really a quality indicator in my practice? Do we even pay attention to this? So one thing that's advocated is, yeah, start a committee on it. Have a wellness champion that works on interventions to make things better. If we don't know that this exists as a problem, then we can't do anything about it. And part of the issue is just putting that light to shine and illuminate where those blind spots are, like we talked about earlier. This is my favorite picture in the entire talk. So a pit stop in a Formula One race. The whole goal, everyone's dedicated to one thing. We get that car out in less than 10 seconds. We change the tires and we fill up the gas, right? It's amazing. These people are working with such coordination and skill. Each one knows their exact role. There's no question about it. And everyone trusts the other person to get that role done. The driver is working to the full extent of his licensure, which is being the driver of the car. And that's all he's allowed to focus on. Never once have I ever seen a driver at a pit stop get out and start changing tires. Right? They're always focused. They're in the car. They're always focused on that. And that's the same mentality that we try to bring when we're working on efficiency models in our office. And so a lot of these things, again, the AMA steps forward. They have a lot of these things listed in ideas of how things can be better. But this whole idea of team-based care, delegation of things to different members of the staff so we can keep the doctors doing what they do best, which is seeing patients. Rooming checklists, synchronized prescription renewals, all these different things, in-basket management, all these things are kind of on that website. So I'm not going to go too far into it further. They have nice slides like this where it can show how much money it can save you over time if you use some of these initiatives and so forth. So I encourage all of you to take a look at that. And then system changes. So 80% of burnout is systemic. It has been proven that individual interventions alone do not create sustained change. You can do resilience, you can do mindfulness, you can do all these different things as an individual, but if the system doesn't change or the culture of where you work doesn't change, those interventions do not create lasting change. So it's imperative that if we want to improve this, it has to be done from top to bottom. So at WellStar, we engage from the C-suite all the way to the front lines, and everyone's involved with this. So some of the things we talked about, we actually have started an EHR optimization team. We use Epic. Different people use different systems, but I'd urge everybody to become a super user, right? Know all the ins and outs of your medical records so you can save as much time as you possibly can. Invite your support team back in to look at your practice and see what ways that you can optimize how you use EHR and make things easier for yourself, and what ways team-based care can be utilized more effectively. Professional development. Can we create niches for ourselves as physicians where we can spend at least 20% of our time doing what we want to do the most professionally? It's been shown through studies that all you need is that 20% to get to professional fulfillment. Leadership development. There was a study using a metric of leadership trust that was developed at Mayo. And what it showed was, as trust in leadership increases, physician satisfaction increases as well. And so do we trust our leaders? Do we trust that things are happening in a way? Do we feel heard by our leaders and they understand what we're going through on the front line? Mentorship. Do I have someone that can guide me in times where I need it, that can be my sounding board? We talked about resiliency training. The policies and procedures of our practice. What does that say about what values we hold true? What does that say about our culture? And finally, this idea of culture and mission and values. I mean, am I aligned with the values of the organization that I work for? Typically, physicians that are aligned with the values of the organization tend to stay around longer than those who don't. From Johns Hopkins, the dean out there, he kind of summarized a lot of these thoughts. It's hard to imagine a more critical issue for healthcare leaders than combating burnout and attrition. Happier care providers are better care providers. It's about quality of care and doing what's best for our patients. I mean, this idea of better patient care, access to care, it's almost like it's a public health issue. It sure feels like it. So all of you shoulder the responsibility of the well-being of your practices. And for that, I applaud you. And I think it's really fair to ask one question. What about my own well-being as I'm trying to do this? And my hope is that you're going to invest in that too. Thanks, everybody. Appreciate your time.
Thank you. That's excellent information. Some of the stats are a little scary to me, and probably some people were looking at it the same way. Didn't know that, 400 physicians are committing suicide a year. One of my questions before we open it up here, trend lines. I mean, are you seeing, is there a correlation between some of these statistics and how medicine's changed, how healthcare delivery services have changed the last 10 years, 15 years? Is that, do you think, part of that? Do you have any thoughts on that?
I mean, I think the bigger issue was, did we know what a big problem this was for so many years? I don't know if we had a full understanding of it. And the fact that we can't even see it in ourselves, it highlights this idea that, maybe we weren't talking about it. And certainly the culture in medicine through training is that you don't talk about these things, right? You suck it up, you move forward, you don't complain about this. And so that's part of the issue. And so I think breaking down those barriers, some of the work that's been done by the Mayo Clinic and at Stanford is really groundbreaking, because it really forces us to come to terms with things that we never talked about before.
So Vivek, if I understood it, just to repeat that part, so it was the bottom 30% of what troubled physicians that others recognize, only what, 70% of them recognize?
So the people that scored the worst on that metric, 70% of those people thought they were average or above.
So they didn't even recognize in themselves that they were at risk, yet everybody else did around them. So I've got a question for the group here, just thinking about this, and it's similar conversation in the other room about, or actually we're here with Jillian about staffing and knowing there's troubled people, and there's people that need to be terminated, right? They need to move on in their life, as I was saying, find something they're good at. How many folks in this room just know within their practice a physician that might be overstressed or in trouble or not to this level, but just of concern? Anybody? Show of hands. There's one. Yeah. It's a difficult issue too, right? Because like you say, with training and resiliency, and this is what they're supposed to do, but it's an issue. How do you address that? I mean, how do you approach that, right? Because that's an integral part of the practice and productivity related to patient and quality of care. So who has some questions for Dr. Gurudutt? I'm going to say it over and over. I like saying it.
Isn't, having worked with doctors for decades, we have a preponderance of masters of the universe practicing medicine. And shouldn't that whole process start at the medical school level, where there should be more training on, you're becoming a master of the universe, but you've got to look in the mirror and assess yourself accurately? For sure. And I think that movement is there. A lot of medical schools and residency programs are creating their own wellness programs that never existed before. And some of it, unfortunately, is because of resident suicides and physician suicides that have occurred on campus or within their jurisdiction. So I think there is a cultural shift happening. There is a cultural shift happening, and I think that is important to bring that to light.
I'm going to work my way around the room for a question. So what do you suggest relative to staff recognizing the issues, and how do you approach something like that?
I mean, I think the first thing is, do we recognize it? Can we have a discussion about it? Do we have a safe space to discuss these things? Are we creating a space in our offices that allows us open conversation, a compassionate discussion that's not judgmental, and a way that we can look after each other's well-being, not just our own? Can we hold each other accountable for each other's well-being? And I think it starts with that conversation.
So being a room full of, mostly non-physicians, working very closely with physicians, obviously you all are overachievers, right? That's what got you into medicine in the first place, truly. And I think about, that 30% or 70% don't even recognize that they're kind of on the path to burnout. I think there's a much higher tolerance before burnout in those of you that are otolaryngology, oncology physicians. So that being said, from an administrative standpoint, you were just starting to touch on it. Creating a culture where there's conversations, great, but what's something very tactical that we can do for our physicians to, once we see it happening, to help them get out of that? Like, so, demand they go on vacation, or?
Well, I think that there's different parts to that, and I think each situation, each individual, you need a separate thing. But creating an opportunity for mentorship in your practice, where other physicians can talk to the physician that you're worried about and really delve into things beyond just medicine, really delve into things that go beyond what they, just the clinical medicine aspects, but what's going on in their personal life and beyond, and how they deal with, what is their method of dealing with the distress that they feel. Some of this is not just a conversation. Some of this may require counseling, professional counseling. And so recognizing where kind of on the spectrum we are is one. Certainly taking care of the low-hanging fruit. The reason why we talk about stuff like workflow and all these things is because that's low-hanging fruit. That's stuff that we can do that's easier to manage than the burnout state of a physician's mind. And so certainly tactically, I would try to take care of all the things that are stressors that are controllable, and then work with the individual, whether through a senior physician or whatnot, to see if they need counseling and help beyond before it gets, to depression and suicide and so forth.
Your question, great.
You talked about that other physicians can help their physician in that practice. What about those practices when there's only one physician who's stressed out or feel like getting burnout? How he can manage his burnout or stress, because he doesn't have any other physician in the practice who can help him?
Well, the medical community in and of itself, there are other people around that this person may interact with that are not in their practice that might be in the medical field. It doesn't have to be someone in the medical field. The truth is, it's just someone that they can relate to. And then bringing forth, some of these ideas of, wow, do I really have issues here or not? And part of those ideas of putting up those metrics, part of the reason for that is to add an illumination to where someone really sits that they may not even recognize. And so part of this is just recognition of the problem. And so once a physician recognizes there's a problem, perhaps then things like counseling or mentorship or whatnot can become more applicable. But if they can't recognize it, certainly being told, hey, I think you're burned out, it's not probably going to help, right?
That just ties into what we were talking about earlier too, is, I'm thinking you're asking the question from a physician perspective, but from an administrator perspective, it's exactly the same dilemma of I'm dealing with all this stress and anxiety and I don't have anybody to talk to. And so there really is that approach of really helping them to have some tribe time as well, getting your doctors to connect with other doctors, getting them to take a break, helping them to find maybe another doc across town that they can collaborate with on some cases, or, just again, having, networking. Yeah. So just another thought too there.
There is an idea of something called commensality, which is like sharing a meal with another person. And what the Mayo Clinic does is they actually have groups of 5 physicians, and they pay for their dinner, and they go out to eat once a week, maybe once a week or once every other week. And they've found better engagement because they have a chance to connect. The idea of social interaction on a level they can talk about things in a safe environment has value.
Great information. Any other questions, thoughts? Let's give another round of applause. Appreciate it.